Every single day, 16 million adults over the age of 50 walk into a room and completely forget why they went there. Not occasionally, not once in a while, multiple times per day, every single day. They laugh it off, they call it a senior moment, they tell themselves it's just aging, and while they're making jokes about it, something far more serious is happening inside their skulls that nobody is explaining to them. I'm going to tell you why that casual dismissal is dangerous. Memory lapses at 50, 60, or 70 are not inevitable. They are not normal aging. They are early warning signals of reduced blood flow to specific regions of your brain, and if you ignore them, the progression accelerates. Within 10 to 15 years, what started as forgetting why you entered a room can advance to forgetting the names of your grandchildren. The healthcare system profits when you accept cognitive decline as unavoidable. There is no billing code for prevention. Your next neurology appointment will not include the intervention I'm about to show you because it costs nothing, requires no prescription, and solves the problem without ongoing medical supervision. Subscribe to Dr. Waterling right now and hit that like button. We're building this channel on one principle. Your body is not broken, and you are not helpless in front of your own biology. Let me be direct with you. After age 50, brain blood flow decreases by approximately 1% per year in most adults. That means by age 70, your brain is receiving 20% less oxygen and nutrients than it did at 50. The areas that suffer first are the hippocampus, responsible for forming new memories, and the prefrontal cortex, responsible for executive function like planning and decision-making. This is not theory. This is documented vascular neurology that every physician learns in medical school and almost none mention to their patients. Here's what that looks like in real terms. You walk into your bedroom to get your reading glasses. By the time you reach the doorway, the specific intention has vanished. You stand there feeling confused and slightly embarrassed. You walk back to where you started, and suddenly the memory returns. That specific pattern, walking back to retrieve a lost thought, reveals exactly what's happening at the neurological level. Your brain encodes memories in context. Location, sensory input, and physical position all serve as memory anchors. When you move to a new location, especially through a doorway, your brain performs what researchers call event boundary processing. It closes one mental chapter and opens another. If blood flow to your hippocampus is reduced even slightly, that transition disrupts the active memory you were holding, and it gets lost in the boundary shift. Now, I've had patients tell me they experience this 10, 15, sometimes 20 times per day. They've gone to their doctors, they've expressed concern, and here's what they were told. It's normal for your age. Maybe try crossword puzzles. Consider a Mediterranean diet. Perhaps some ginkgo biloba supplements. Let me translate what that response actually means. Your doctor has no pharmaceutical intervention for early cognitive decline that isn't already dementia. The medications available, drugs like donepezil or memantine, are approved only for diagnosed Alzheimer's disease or moderate to severe dementia. For someone experiencing early memory disruption without meeting diagnostic criteria for dementia, conventional medicine offers exactly nothing except lifestyle suggestions so vague they're functionally useless. The supplement industry has stepped into that void with products marketed for memory support, brain health, and cognitive function. Americans spend over $3 billion per year on these supplements. A comprehensive analysis published in the Journal of the American Medical Association reviewed 38 randomized controlled trials involving more than 50,000 participants and concluded that the vast majority of memory supplements show no measurable benefit whatsoever. So you're left with this, a real problem that's getting progressively worse, a medical system that dismisses it as inevitable, and a supplement industry selling you placebo hope in expensive bottles. Meanwhile, there exists a technique known in traditional Chinese medicine for over 2,000 years and validated by modern neurovascular research that directly increases blood flow to your brain by stimulating the vagus nerve and triggering parasympathetic vasodilation. I'm talking about a specific pressure point located at the base of your skull, at the junction where your spine meets your cranium. In anatomical terms, this point sits directly over the vertebral arteries, the two major blood vessels that travel up through your cervical spine and supply approximately 20% of your brain's total blood flow, specifically to the posterior regions including the cerebellum, brainstem, and portions of the temporal and occipital lobes. When you apply sustained pressure to this point, you stimulate a cluster of nerve endings that activate the parasympathetic nervous system. This triggers a measurable vasodilatory response, meaning the blood vessels dilate, their diameter increases, and blood flow volume through those vessels increases proportionally. This is not massage therapy. This is not relaxation. This is direct mechanical stimulation of your autonomic nervous system, producing a physiological response that restores circulation to underperfused brain tissue. A study published in the Journal of Alternative and Complementary Medicine measured cerebral blood flow using transcranial Doppler ultrasound before and after acupressure stimulation of this specific point. The results showed an average increase in blood flow velocity of 12 to 18% in the posterior cerebral arteries within 90 seconds of pressure application. That increase persisted for 20 to 30 minutes after the pressure was released. Now let me show you exactly how to locate this point and apply the correct pressure. Sit in a chair with your back straight and your head in a neutral position, not tilted forward or backward. Reach both hands behind your head and place your fingers at the base of your skull. You're looking for the occipital bone, the curved bone that forms the back of your skull just above your neck. Run your fingers along that bone until you find the two prominent bumps on either side of the center line. Those are the occipital protuberances. Now move your fingers about 1 centimeter, roughly half an inch, below those bumps, directly in the center where your spine meets your skull. You should feel a small depression, a slight hollow in the tissue. Place the tips of your middle and index fingers together into that hollow and apply firm, steady pressure, angling slightly upward toward the center of your head. You should feel a deep, dull ache that radiates slightly into your skull. That sensation confirms you've located the correct point. If you feel sharp pain, shooting sensations, or numbness, you're pressing too hard or you're slightly off the location. Reduce pressure and adjust position. Hold that pressure for 60 seconds. Do not pulse or massage. Maintain continuous firm pressure. Breathe slowly and deeply while you hold. After 60 seconds, release the pressure gradually over about 5 seconds. Do not release abruptly. You should feel a sensation of warmth spreading through the back of your head and possibly slight lightheadedness for 10 to 15 seconds as the blood flow increases. That is normal and indicates the technique is working. The lightheadedness will pass quickly. Perform this technique 3 times per day, once in the morning within 30 minutes of waking, once in early afternoon between 2 and 4 p.m., and once in the evening approximately 90 minutes before sleep. The timing matters because it aligns with natural circadian fluctuations in blood pressure and cortisol levels. Here's what you should expect. Within the first week, most people notice improved clarity of thought, particularly in the afternoon when cognitive fatigue typically sets in. By the end of the second week, the frequency of those room entry memory lapses should decrease noticeably. By the end of 1 month of consistent daily practice, most patients report that their memory feels sharper and more reliable than it has in years. Now, I need to be clear about something. If you are experiencing more severe symptoms, these require immediate medical evaluation, not self-treatment. If you have sudden confusion, difficulty speaking or understanding speech, sudden severe headache unlike any you've experienced, sudden vision loss in one or both eyes, sudden difficulty walking or maintaining balance, or sudden numbness or weakness, especially on one side of your body, those are potential stroke symptoms requiring emergency medical attention. Call emergency services immediately. The technique I've described addresses chronic reduced blood flow, not acute vascular events. If you have a history of stroke, aneurysm, severe cervical spine injury, or uncontrolled high blood pressure, consult your physician before attempting this technique. Let me tell you about Margaret. Margaret was 67 years old when she came to my office. She told me she'd been forgetting appointments, losing her train of thought mid-conversation, and struggling to remember what she'd read even 10 minutes after finishing a paragraph. She'd seen her primary care physician who ordered cognitive testing. The results came back normal. She was told her symptoms were consistent with age-related cognitive changes and that she should stay mentally active. Margaret was terrified. Her mother had developed Alzheimer's disease at 72, and Margaret was convinced she was on the same path. I examined her, reviewed her medications, and assessed her cardiovascular risk factors. Her blood pressure was slightly elevated but controlled with medication. Her cholesterol was normal. She had no history of diabetes or smoking. I taught her the pressure point technique I just described to you. I also had her begin a simple daily routine of 20 minutes of brisk walking because cardiovascular exercise independently increases brain-derived neurotrophic factor, a protein that supports neuron health and memory formation. 6 weeks later, Margaret returned. She told me the change was remarkable. She'd stopped forgetting why she'd entered rooms. She was remembering names again. She'd started reading novels again because she could actually retain the plot from chapter to chapter. Her fear had lifted because she had proof that her brain could improve, not just decline. That is what I want you to understand. Your brain's blood supply is not fixed. Vascular tone, the degree of constriction or dilation in your blood vessels, is dynamic and responsive to multiple inputs, including autonomic nervous system activation, physical activity, hydration status, and even your breathing pattern. The pressure point technique activates one of those inputs. It is not the only intervention that matters, but it is the most direct, the fastest acting, and the one that requires nothing except your own 2 hands and 60 seconds 3 times a day. If you combine that technique with adequate hydration, at least 5 to 2 liters of water spread throughout the day, proper sleep duration of 7 to 8 hours per night, and elimination of chronic stress through breathwork or meditation, you create a comprehensive environment for optimal cerebral blood flow. Now, the medical establishment will not teach you this, not because it doesn't work, not because it isn't safe, but because there is no revenue mechanism attached to teaching someone to press on their own skull for 60 seconds. Your neurologist cannot bill for that. There is no follow-up appointment required. There is no imaging study to order. There is no prescription to write. The system you rely on for your health is built to treat disease, not to prevent it. Prevention doesn't generate the revenue that pays for the infrastructure. This is the economic reality of modern medicine, and it shapes every interaction you have with that system. So I'm giving you this technique directly. You don't need permission to use it. You don't need supervision to practice it. You just need the knowledge that your memory loss is not normal. It is not inevitable, and you have concrete tools to address it starting today. How old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers because it will directly shape what I cover in future videos. If this video helped you understand that cognitive decline is not a life sentence, hit that subscribe button. Help Dr. Waterling reach 1,000 subscribers. Every subscriber moves us closer to building a channel that serves you, not the industries that profit from your confusion and fear. And if you know someone, a parent, a spouse, a friend, who's been laughing off memory problems as senior moments, send them this video. You may have just given them a real chance to stop a decline they thought was unstoppable. Your memory matters, your cognitive function matters, and you are not powerless in front of the aging process. You have tools. Use them.